Hello, my name is Jason Wingett. I'm a certified emergency nurse at Blake Medical Center in Bradenton, Florida. Today I'm going to be discussing the GoodRx Discount Medication and Identification app. This is an application that I use to advocate and educate my patients in regards to pricing and prescription of medications that they are prescribed in our emergency department. Recently, our hospitals have been inundated by the flu, just overrun with numbers. The last Monday, February 22nd, we had a severe overrun of our system, and quite a few of those people. I personally had 15 that I discharged on the day were positive for flu and given Tamiflu. These are all the quotes you see here are from Dr. Raw. This is out of a newspaper article, the Bradenton Herald, in response to questions regarding the overrun of our emergency departments. So Tamiflu cost on average. The cash price average was $164.31. That was an average of three pharmacies in our area. So not exactly cheap medication for them to treat themselves. So that's where the GoodRx medication app comes in. I can quickly first just go in and type in the drug or condition that I'm looking for. In this case, it's Tamiflu. Second, I just put in the dosing and the amount given, and it returns with a quick overview of everybody in the area. These are all within or near my hospital, so I can point the patient in the right direction. And then lastly, it gives you a code that if you have the application, you can show them the code, and or if I'm using a desktop, I can print out the code for them, and they can take it in and give it to them to honor the price or get very close to the price. So this day I was able to save my patients that were paying out of pocket $23, making them a little more likely to get their prescription filled. Unfortunately, Publix, I've learned, does no longer take the GoodRx app. So here's a list of medications that I will send my patients to Publix. They're all free. They just fill out the paperwork, and meds are free. Medication comparison. In this case, Cipro eardrops versus eye drops. Of course, Cipro eardrops used for ear infections. They can be interchanged. The eyes could go in the ears, but not vice versa. And as you can see, the Otic drops, Winn-Dixie price $103.41. Typically, what the prescriber prescribes, versus the eye drops, which is only $4. And they can be interchanged. So if I see this situation presenting itself, I can recommend to the practitioner, or we can discuss it and try to get them to prescribe the eye droppers for the ears, and saves them about 99 bucks. Little identification feature, neat little feature of the app, where you can just go in and punch in some identifying properties of the pill that you might want to locate. It's helpful, patient might be unconscious and found with unknown pills. Just type in the number found on there and type in a color or shape, and gives you a neat little picture, so you can confirm that that's actually what you're looking at. If you don't know what to do with it or exactly what it is, certainly call Poison Control, 222-1222. GoodRx Summary app is free and easy to use. It's easily accessible from any computer. Can be accessed from the home page, the GoodRx.com. They do not share your personal information. And although it's not 100% accurate, you can use it as a price point to advocate and to educate your patient. If they're able to fill their prescriptions, they're less likely to come back to the ED, and of course, it's gonna reduce our overall census. So I'd like to thank you for viewing my presentation. It's been a good semester, and I look forward to seeing yours.